So how do you move an idea forward? We all know that it's not enough to have a great idea. Ideas do change the world, but only if they're implemented effectively.
Our healthcare problems in both this country and the developing world will not be solved by doing more of the same. What we're doing in the Healthcare Initiative is consistent with what Harvard Business School has always done. We want to train and educate leaders who will make a difference. Healthcare certainly needs leaders who will make a difference. It certainly needs innovators.
My company is Vaxess Technologies, and we are working with a proprietary technology that allows us to create heat-stable vaccines. And the end product that we produce, it's a thin film that's then put in a vaccine vial, shipped around the world at any temperature, at which point it's reconstituted, dissolved again, and delivered to the patient in the exact same fashion as current vaccines. So Vaxess Technologies was actually an outgrowth from an HBS class called Commercializing Science. After the class was over, we decided to formally incorporate the business, license the technology, and that's allowed us to move the technology closer to making a positive impact on people's lives. So ultimately, founding a company like Vaxess requires a tremendous amount of resources and also access to information, experts' knowledge. The iLab provided all of those to Vaxess Technologies, which was key in getting us to where we are today.
The healthcare initiative is really an umbrella, and it's an important umbrella. It's one that sits across everything we do in healthcare here at the school. It goes from MBA program to our alumni of the MBA program, executive education, the alumni of our executive programs, to our faculty and doctoral students.
The challenges we faced over the years in running the Lagoon hospitals has been providing quality health services, and on the other hand, providing access to the widest population as possible.
The work that Fola Laoye is doing with Hygeia is quite incredible for that environment. We have a setting where private healthcare is very nascent in Nigeria.
The Harvard Business School education has been extremely valuable to some of the other clinician managers who have also had the opportunity to go for the executive programs.
In healthcare, executives are particularly interested in gaining more management expertise.
Focus on it, get it done right. That's the scientist in her head.
Because they've come from a clinical background initially.
We've brought that back here now, particularly in the area of mother and child care. And we've created a very strong integrated mother and child clinical healthcare platform. And I think that in itself has been extremely special.
Virtually every faculty who's interested in healthcare has relationships and projects they're doing with the rest of the university. We run a forum on healthcare innovation jointly with the med school. It's truly an example of both cooperation across the university, but where the sum of the two is greater than the two parts are alone.
Yeah, so what we are developing at Moderna, we manufacture messenger RNA, so a patient will themselves make the protein that they are lacking to restore their health. So the partnership is actually one of the biggest deals ever done between a large pharmaceutical company and a biotech company in the history of biotech. When I was building our strategy to get that deal to the finish line, I was using things I learned at HBS, like how to negotiate. And I think that's the power of HBS is you don't realize it, but slowly, day after day, they transform you.
I've been a doctor since 2005 and have been working in the UK's National Health Service. I'm a joint degree student between Harvard Business School and Harvard Kennedy School. I think that the Kennedy School is fantastic at really giving you an idea of social policy broadly. Harvard Business School really adds value in being able to put those ideas into practice in a sustainable way. I came here because I had a passion for trying to change healthcare. Some people say that's naive, but I don't think anyone challenges the need for change. And I honestly believe that by being here, I'm really going to be able to have a much more powerful impact in the world.